Fellow viewers, thank you very much for joining us today in Golden Minute Show. When a baby is in uterus, it survives like a fish. It's the water that supports its life there. But sometimes this water can break before the baby is term, meaning before the baby is at the age to be born. This is what we are discussing today. Privileged to have Dr. Kioko with us. Hi, Dr. Ari.
Hello.
It's an honor to have you here.
Thank you very much.
Welcome.
Thank you very much for having me over, for inviting me to your show. And I have been a great follower of this show.
Thank you.
Yes. And I really appreciate the work that you're doing.
Thank you.
And the effort you're making to really bring out the issues that affect the outcomes in terms of mother and child health. And I do hope that with the following of the show, that even our viewers are back at home will be able to benefit from this show and from the very vital information that is being passed. And then we want to see a healthy nation, because once we have healthy mothers and healthy babies, then we have a healthy nation.
Sure.
Yes.
Now today we are discussing premature rupture of membranes. When do we say that the waters have broken area?
Okay. Ideally, what should happen is, once the baby gets to term, and by term here we mean the baby is ready to be born, or has reached the age at which they should be born, usually is around 38 weeks, which what we call our 9 months. Ideally, the waters should break once the labor pains have started, or after, even if the water breaks earlier, the labor pains should start thereafter. But we have situations in which the waters break earlier. That is before the baby gets to the 9 months. Or sometimes they do break, and then within a day, that is 24 hours, the labor pains do not come about. So we have risks that are associated with the early breakage of water without labor, which whether it occurs before the baby is term or after the baby is term.
Thank you very much. Now, if there are risks, then it means this water is important.
It's very important.
Can we talk about this importance before we go to the risks?
Thank you. So this water that is usually inside the baby's house, what we call the womb or the uterus, is very important. It's produced by the placenta. Remember, the placenta is that organ that connects the child to the mother.
I usually call it the second mother to the baby.
Yes.
Am I slightly right?
No, you are very right, because it's the one that actually feeds the baby before the mother actually sees the baby.
Sure.
Yeah. So while the baby is in the uterus, it is the placenta that actually feeds the baby.
So it's also a second mother.
It's a second mother. You are very right. So this placenta, in addition to feeding the baby, it produces the fluid, or that water that the baby usually grows in. This water is very important for the development of the baby, because what it does, number one, it is the one that allows this baby to swim freely, to move freely within the fluid, and this enables the baby to develop in terms of muscular development, and also it's very important for the development of certain internal organs, such as the lungs. While inside, the baby breathes in this water. It actually goes down to the lungs, and it helps the lungs to expand. Okay. And also,
you want to say mtoto anaikunywa?
Yes, anakunywa.
Okay.
Drinks this water. It helps the lungs to expand, because it is able to occupy the spaces, and the baby is able to, the lungs are able to develop and mature appropriately. The other thing which this water does, which is very important, is it acts as a shock absorber. Meaning, if there is any external injury or pressure that the mother encounters across the abdomen,
for example, falling.
Yes,
if she falls,
or if she's hit by any object, be it accidental, be it intentional, this water absorbs most of that force.
Okay.
So the baby is protected even if the mother suffers an external pressure. The other thing which is very important as well is this water, because it's at a very conducive temperature, it keeps the baby very warm.
Whether it is cold outside or hot,
yes,
the baby has its regulated temperature.
Its own temperature, at its own very nice environment in which it is able to grow. Yes.
Thank you very much. Now, what would happen if this water is too much?
Okay, yes.
Or is it possible for this water to be too much?
Yes, there are situations in which this water can actually be too much. It is true. And okay, ideally what happens is the baby as it develops, while inside that environment, inside that water, it drinks the water and it actually excretes the water as urine. So what happens is, in conditions in which the baby is not able to drink that water, that water would be too much.
Too much.
So sometimes we find conditions in which the water goes and becomes too much, or in other situations the water can, in other situations where probably the mother has certain conditions, such as diabetes.
Okay.
Yes, if the mother has diabetes as well, that is a big risk factor for the water to be too much. In other cases where we have multiple babies, that is more than one baby, the water again might be too much, be a lot, and sometimes puts pressure on the uterus.
On the uterus.
Yes.
Okay, now we've talked about too much water.
Yes.
Can it be too little?
It can be too little. Yes. Again, there are circumstances in which the baby's development, or as a matter of how the baby has been formed, certain organs in the baby do not form properly. An example being the kidneys. So remember, the kidneys make urine.
Oh, sure.
So these babies take in the water, but they are not able to get out the water because the kidneys are not functioning. So with time, as the baby is taking more water without excreting any, because part of the amniotic fluid, or most of it, actually comes from what the baby excretes, this water continually goes reducing in amount. The other thing, which probably is very concerned, or what we are concerned with today in the topic we are discussing, is once you have the water being produced even in normal amounts, but you have a leak. You know, it's like when you have a tank and there's a tap.
Okay.
So this water, in terms when the membranes break, the water will be less than it should be.
Sure.
So that is another risk factor, for which, if we look at the amount of amniotic fluid, or the amount of fluid in the uterus, it will be reduced in cases where there is leakage of the water through the birth canal.
And there are any dangers to the baby, specifically, if the water is too little?
Yes, yes. Remember, when we were talking about the functions of this water, if we lose this water, we lose the benefits of the water.
Oh, sure.
Yes. So, first of all,
there's no room for swimming.
Yes. So this baby is in a very compressed environment, because this water gives time and space for the baby to swim around, to extend, to basically move around their limbs. So first of all, this baby, the muscles and the joints will not develop properly. This baby is in a restricted environment.
Sure.
So they'll develop certain conditions. The muscles will not develop as well, and they'll get even certain issues with the joints. An example is what we call clubfoot. Clubfoot, where the legs are quite shortened, and they are, they are bent in certain ways because during pregnancy they were not able to extend, as well. The other very big risk to the development of this fetus is, remember we said that this water helps the lungs to expand, because the baby is able to take it in and it goes down into the lungs. So if this baby is not able to take in the water, or there's not sufficient water for the baby to take in, what happens is that the lungs of this baby do not develop properly. So this baby develops issues with breathing, and issues with development of the chest wall as well, because remember, it's the lungs that expand the chest wall.
Sure.
Okay. Another very big risk to the baby this time is, once the water is, or once we have water coming out through the birth canal, remember, this membrane, this fluid, or this liquid, this water is contained within a very special pocket that has some membranes, some 2 or so membranes, that hold this water in place. So in case there is a rupture, or there is anywhere where this this very protective barrier is breached, we can have certain bacterial infections that go up the birth canal and get inside now that fluid and infect the fluid. That puts the baby at risk.
Because when the fluid is infected, the baby can also be infected.
Yes.
Thank you very much. I think we'll go for a break. When we come back, we'll discuss the risks.
Okay.
Don't go. We'll be back soon. Welcome back to our show. We are having a great discussion about the waters that supports a baby's life before it is born. Daktari, before we went for a break, we were talking about the risks.
Yes.
We were about to talk about the risks.
Yes. First of all, Anne, let me just recap a little bit. We have now this, as we mentioned earlier, these waters can break at around the time when the baby is term. That is what we call premature rupture of membranes. That is, the membranes rupture. Yes, the baby is term, but it is not followed by labor. Okay?
Okay.
It is just that the membranes have ruptured, the water is coming out, but there is no pain to push out the baby.
Let me get this right. When the waters break, labor should follow.
Yes.
So when they break and the labor does not come,
Yes.
it's premature rupture of membranes.
Yes.
Okay, the second one?
And we do have other situations where the water breaks before the baby is term, what we call preterm, meaning the baby is not term, premature rupture of membranes. That is for a baby that is 37 weeks and below, and the waters have broken. Okay? Which is different from a term baby that is 37 weeks and above, in which the waters have broken without labor. Okay? Now, the risks that put a mother at a risk of developing this condition. The first one is we want to look at issues that increase the pressures within the abdomen. Remember, this is like putting water in a balloon. So if the water in the balloon becomes too much, the pressure is going to burst the balloon.
Sure.
Exactly. So number one condition is which you have is what we had talked about earlier. When you have too much amniotic fluid, in what a condition known as polyhydramnios, too much water, the water can cause, or the pressure, increased pressure can cause the membranes to give way. Okay. The other cause, which is also quite common, is when you have multiple pregnancy. Remember, babies also have some weight.
Sure.
So these babies, the more the baby is in the uterus, the greater the risk of these membranes actually giving way. Okay. The other thing which we pointed at also as well is when you have an infection that is ascending through the birth canal of whatever type, mostly bacterial, and this infection infects these membranes because they are usually actually just above what we call the cervix, in the birth canal. Once these membranes become infected, they can weaken, and this can cause them to break. Okay. The other situation in which this could happen is when we have certain lifestyle conditions, such as smoking. Remember, smoking in a mother who smokes, the tissues basically are generally weaker than mothers who do not smoke. And this would lead to the membranes being formed being less able to sustain this pregnancy. Another big contributor as well is when the mother has what we call hypertension or high blood pressure. It is a common disease which occurs in pregnancy, and this will also put the mother at an increased risk of getting rupture of membranes. That is, the membranes will give way and the fluid will drain out. Yes.
Thank you very much, Daktari. Now, I'm wondering, we have a mother who is pregnant.
Yes.
Is it possible to tell if she has too much water or too little water?
Yes, it is possible to tell, because we expect that the pregnancy grows at a certain rate that we can more or less are able to determine. So in certain conditions, we might be able, just clinically, first of all, from talking to the mother and gauging what her gestation is, we are able clinically to determine, have a high index of suspicion that this mother might have too much fluid. One, if this mother's abdomen is a bit bigger than what you would expect for a certain age of the baby, what we call the gestation. If this abdomen is slightly bigger, you would ask yourself why.
That's what you call the fundal height.
The fundal height, why is this fundal height bigger than these dates this patient has given? So at the back of your mind, you'd want to ask yourself, is there too much fluid in this abdomen? There are situations also as well in which the fluid could be a bit less. So in such situations, now the fundal height would be smaller than what the mother has given.
Than the expected gestation.
Yes. So you would find probably, if let's say the mother tells you she's at 28 weeks, and you find that the fundal height is around 20 weeks, at the back of your mind you would ask yourself, is our fluid too little? There is a more accurate way of determining how much fluid is in this uterus. So the best way to do it is to actually send the mother or have the mother undergo an ultrasound scan, which is able to determine how much fluid is in the within the uterus, and then you are able to advise the mother accordingly. Yes.
Thank you, Daktari. Now, would you mind telling us about the clinical signs to the mother?
Okay. Thank you. Once the mother, or when the mother is able to tell that there is rupture of membranes, most of the time there is usually fluid that comes out of the birth canal. That's water. It's watery. Most of the times it's painless. There is the water might be enough to flow either to soak the undergarments or even so much that it goes down to the floor. So if there is a sudden release of water from the birth canal, most of the time that is painless, that mother should suspect that they have ruptured their membranes. And it can occur at any gestation. It doesn't have to be when the mother is approaching term.
Now when you say that, I would also add then it can also happen anywhere.
Yes, anywhere. When you're walking, when you're seated, sometimes you might not be able to identify a certain risk to it. It will just happen suddenly, without notice, and even sometimes will be painless.
Even when you're sleeping?
Even when you're asleep.
And you said it is not accompanied by labor?
No.
So when it happens and the mother doesn't, like it has happened 2 hours after, there's no sign of labor, then the mother should think of going to the hospital?
Yes. Any drainage of fluid from the mother should be an early sign that she needs to get to a hospital as soon as possible. It is not normal in any pregnancy for the fluid to come out.
I love that. It is not normal.
Yes.
Thank you very much. I think we need to go for a break. When we come back now, we'll talk about the risks after the waters have broken. Don't go. We'll be back. Thank you very much for staying with us. For any comments, compliments, or questions, write to us through the number on your screen. Back to you, Daktari. Now, when the waters rupture, are there any risks either to the mother or to the baby?
Yes. As I said, this waters perform specific functions. So one, if these waters rupture before the baby is term, the biggest risk to this baby is what we call premature labor. That is, once the membranes rupture before the baby is term, labor follows. It has been shown that labor follows either a few days or a few weeks thereafter, depending on the kind of management that is undertaken. But inevitably, labor will occur in the long run. And most of these babies are actually born before term, that is premature. And we have most of the risks that occur with premature labor actually caused by preterm labor secondary to premature rupture of membranes. So it's a big contributor to birth of children before they are term.
Okay.
The second thing, which is a big risk to the mother, is this infection or this rupture of membranes does bring about infection. Infection goes both to the baby and to the mother. Because remember, these membranes are part of the mother's body. So you will get a local infection of these membranes and a more severe infection, which actually spreads to the whole body of the mother. And this can actually put the mother's life at risk. Because if the infection is so severe and the baby, the body is not able to fight it, we can actually lose the mother because of that infection. The other thing, which is also quite a big risk, is depending on how the baby is positioned in the uterus.
Okay.
If these membranes give way and the water goes, you can have what we call the umbilical cord. Remember, the baby is joined to the placenta through an umbilical cord.
Yes.
We can have it coming out of the birth canal before the birth of the baby.
Which is also very dangerous.
Yes, what we call cord prolapse. And what happens is now the baby compresses this cord because it is the one that still feeds the baby, remember?
Yeah.
It has blood vessels in it that feed the baby. So if the baby compresses this cord, the baby is not able to feed itself, and we actually lose the baby unless something is done very quickly.
Very fast.
Okay. The other big risk also is this sudden loss of fluid decreases the pressure in the uterus. So remember, what feeds the baby, called the placenta, is attached to the uterine wall. So if this this sudden decrease in pressure can actually cause the placenta to detach from the uterine wall, and it can lead to massive bleeding, a loss of a risk of either the life of the mother and the baby.
Okay, definitely when the placenta detaches, the baby is not fed.
Yes.
As we said.
Yes.
So definitely the baby is at risk of death.
True. Very true. And okay, apart from that, the detachment of the placenta, apart from the risk to the baby, there can be risks to the mother as well, because now this means there'll be bleeding from the site in which the placenta has detached, and will put the mother's life at risk.
This is what we call antepartum hemorrhage.
Yes.
Thank you very much. Now, let's have a scenario of where a mother comes to the hospital because she realized that her waters have broken before term. What would this mother expect when she comes to the hospital?
Thank you, Anne. Now, it's very important that every form of fluid, as you've said, be attended to in a hospital. We will not advocate for a situation where the mother watches and waits, hoping this will resolve. So it's a thing, it's a condition that will necessitate the mother to get quick attention in a hospital. So when the mother comes, she's usually assessed by the attending clinician, and a decision most of the time is made to admit this mother.
Whether there is pain or no pain?
Yes, regardless whether there is pain or not. The other thing which we also try to look at is the gestation or the age of this baby. Because remember, we said it can occur either before the baby is ready to be delivered or not. So if this mother is not at term or is not ready to deliver the baby, we aim to have a good outcome for both the mother and the baby as best as possible. So we try to ascertain, one, how old is this baby? Can this baby survive on their own? If we get them out, the baby able to breathe. So the other issue is we want to look at the condition of the mother, because we want to have good outcomes for both of them.
Both of them.
So when you are managing the baby, the first thing we want to do is, if the baby is not mature, there are certain things or certain drugs we can give the baby or the mother so that the baby can have an accelerated growth or maturity of the lungs, which is usually an injection given for around 2 days.
Now, who receives the injection?
The mother.
Okay.
The mother.
The mother
So
receives
we give the injection to the mother
for the sake of
for
the
the
baby.
sake of the baby.
That's nice.
Now, the other thing which we do is we try to put this mother in a good place where they can rest. Remember, when you walk around, when she walks around or she moves around when she's still draining the water, she can actually lose all the water. So we have her observed in a situation where she's actually on strict bed rest. And our aim is to have this baby as close to maturity as possible. The other thing which we do is we give drugs known as antibiotics or medicines to prevent infections. Remember, these membranes have broken, so there is risk of infection to the mother. Okay?
So this drug you're giving, not because there is infection, but to prevent infection.
The infection. Thank you.
Okay.
But be it noted that, one, this must be discussed with the mother. We will give you options. If you feel we need to give you time to mature your baby, we actually discuss that with you. But it is important to note that if we suspect that there is risk to the mother, most likely an infection, we deliver this baby regardless of the age of the baby. To save the mother's life and to prevent further infection of the mother, we have to deliver the baby. Okay? If the baby, if we get, I mean, sometimes we get the mother having labor or an onset of labor a few days or a few hours after the membranes have ruptured and the baby is not mature. We do sometimes give certain medications that reduce the contraction of the uterus to give us a little bit more time to be able to give these medications that mature the baby's lungs. So that we have a baby who is, yes, not at term completely, but can sustain breathing on their own. And this baby can be taken care of in a nursery until they attain a certain weight that they can go home. Now, that was a situation in which the baby is not mature. Or we want to probably get some time in which we can mature the baby. In a
prolong its time in the uterus.
Exactly. Okay. So that we can have a baby who is much better adapted to, you know, to breathe on their own and live on their own. Now, in a situation where we have labor, I mean, the water's breaking in a baby who is term without labor, there is more benefit from delivering this term baby than waiting. Because remember, labor sometimes will not come as early. It would go beyond 24, 48 hours. And we put ourselves at risk of having this baby infected.
Sure.
And the mother infected. So we have much more to gain since our baby is term by delivering this baby either through the normal delivery, in which we were able to induce labor in the mother, or if the mother herself is not in a situation, or there are certain situations in which we are not able to deliver the baby via the normal route, sometimes we have to deliver the baby through operative delivery, what is known as cesarean section. Yes. So the point to note is this, that for mothers who get premature rupture of membranes before term, or at any time, one, they must be seen in a hospital. The second thing is we advocate that babies that are born, or for mothers who go into preterm, who get preterm premature rupture of membranes, that is for babies who are less or below term, they should be seen or referred to an institution that is able to take care of these small babies. That is an institution that has a dedicated neonatal unit, because these babies will be born underage, will be born also with low weights.
Low birth weight.
Yes, low birth weights. And they would benefit a lot more from specialized care.
After they are born.
After they are delivered.
Thank you very much, Daktari.
Thank you.
I think we've learned a lot today. Viewers, that's all we had for you today. I believe it's not enough, but we have to call it a day. Thank you very much for being with us in Golden Minute Show, where I remain your host, Anbi, where we fight against maternal, fetal, and neonatal mortality with passion and love. And until we meet again, bye.